We know about measles, COVID-19, and RSV, but there's another infectious disease creeping up from behind that health officials are keeping an eye on.
Overall, I'm not concerned about that for Windsor 6 County Health Unit for the general population.
Tuberculosis, or TB, is a bacterial infection most people think of as a disease from the past, but it's still around, and while treatable, it can be fatal.
TB is not like measles or flu. It takes time. It can be transmitted to people who are in close contact for weeks or months.
There is a vaccine, but most Canadians haven't received it because for decades, TB rates were low. Lately, they've been edging up. So far this year, the Windsor-Essex County Health Unit has identified 62 latent cases. That's when someone is infected but not contagious and usually shows no symptoms. That number is right in line with the 5-year average. But active cases are what stand out, 7 so far in 2025, compared to a 5-year average of just 2.6 by this point in the calendar.
It's not just Windsor-Essex. We see that in the rest of the country, around the world, so it's a global trend.
In Saskatchewan, TB rates are more than double the national average, and researchers are racing to develop better vaccines and treatments. At a research center in Saskatoon, scientists say progress against TB took a hit during the pandemic as resources were redirected and symptoms missed.
TB was very much in control until COVID hit. We were on track to, the rates had fallen down. But then once COVID hit, all the progress that the world had made in the last almost 10-15 years was all reversed.
That setback, researchers say, underscores the need for new tools and a renewed focus on prevention, but not for panic.
It's not that we walk into a store or, go into the playground, we would be concerned about that. I'm emphasizing that this disease is not very contagious. It takes a long time.
And if you're concerned about your tuberculosis risk, either because of travel plans or underlying health conditions, your family doctor can walk you through testing options or preventative steps. Stephanie.
Okay, Travis Fortnum tonight. Thank you, Travis.